I'm Eleanor Rutter. I'm a public health doctor and I work as part of the public health team in Sheffield. So this is the last of 3 short videos which are focused on when PPE might be required for your professional role and the different types of PPE that your employer might make available to you. So in March of this year, we all now know the government declared a lockdown, and that basically recognised that we had moved into what is termed a period of sustained community transmission of COVID-19. What that essentially means for us as workers is that we need to treat everybody as if we are all potentially infected with COVID-19, even if we're not displaying symptoms. I talked in the previous 2 videos about the most effective methods for reducing the spread of infection between any 2 people. Just as a reminder, that is frequent hand washing with hot water and soap for 20 seconds, paying close attention to respiratory hygiene, that's coughs and sneezes, and thinking about social distancing, which is we've all become very used to now. So in this final video, I'm going to talk briefly about the scenarios when PPE should be used in addition to the more basic measures, or in circumstances where the basic measures are simply not possible. Just for completeness' sake, I'm going to describe the first and most common scenario, which covers the majority of our work roles and interactions with each other. This is where circumstances allow us to maintain a 2-metre distance most of the time, and in these circumstances, no PPE is required. We do need to remember to pay close attention to hand and respiratory hygiene. The second scenario is where brief physical contact might be required between a member of staff and a client or patient. In these circumstances, you will be supplied with a fluid-resistant surgical face mask, which can be used for what is referred to as a session of work. Essentially what that means is that it doesn't need to be replaced between each client interaction. It only needs to be replaced once it's wet or damaged or becomes uncomfortable. However, you must remember that if you ever take a face mask off, it can't be reused. The next scenario is one where prolonged intimate contact would need to take place between a member of staff and a client. For example, help with bathing or going to the toilet. In these circumstances, staff should wear single-use disposable gloves, single-use disposable apron, and a fluid-resistant surgical mask. Again, the face mask can be used for an entire session of work. If a client is coughing or sneezing, you should actually include with that eye protection, which would be either goggles or a visor. You need to take care when removing PPE. Remember, it might be infected. It needs to be bagged and disposed of in a lidded bin, and you need to remember to wash your hands thoroughly afterwards. Now, you might be asked to carry out a task in the home of somebody who is being shielded. These people are classed as ultra vulnerable because of underlying conditions which make very serious illness a real possibility if they were to become infected with COVID-19. In those settings, you should wear gloves, apron and face mask, all of which should be disposed of after a single use. In some settings, you might feel that colleagues from other agencies have more PPE than you do. There are some specialist settings and scenarios that are not covered in these videos which may be applying to those colleagues. All NHS and social care organisations in Sheffield are following the same guidance, so you can be reassured that as long as you've got the PPE described here and you follow the more basic measures described in these videos, you're doing all that's required to minimise the risk of acquiring infection or passing it on to someone else.